the International Association for the Study of Lung Cancer strongly believes that respectful language includes practicing cultural humility and sensitivity by following best practices regarding of race, ethnicity, gender, socio-economic, and geographical description.
We're going to be hearing from a pharmacist now, from Mnema Scholastica. Please, Ma, I don't know if you're on the call. Please, she'll be speaking on the patient's perspective of language as a contributing barrier to care. And pharmacist Scholastica Mnema or Nena Lan is a breast cancer survivor. Wow. I mean, what better person to hear from? And fellow of the Pharmaceutical Society of Nigeria. She's a member of Association of Lady Pharmacists, Benue Breast Cancer Supportive Initiative, the Association of Community Pharmacists of Nigeria, Christian Pharmacists Association of Nigeria, and ambassador of Women in Hepatitis Africa, Live Well Initiative, and International Alliance for Patients Organizations, Personalized Care, Cancer Care Alliance. Scholastica is widely traveled and a co-author of many technical reports and articles in international journals. She's married and blessed with 3 sons. She's thriving. So, yes, you're thriving. I'm so happy to have you. So happy to have you.
Yeah, good afternoon, everyone. I've been patiently and quietly listening to all the interesting presentations, and I'm excited to be part of it this afternoon. I'm speaking on the perspective of the patients as language as a barrier to care. Yeah, I don't have slides, but I'm going to share some personal experiences. For a patient receiving care, most times the terminologies used are not what the person is familiar with. You tell the person stage 1, stage 2, stage 3, doesn't mean anything. It's not very clear to the patient what all of this means. So it's important that when a patient receives a diagnosis and gets some of the laboratory investigations out, it's good to have them clearly explained. I got confused myself at the stage. I got confused too, as I would say, as learned as I was. I didn't know what some of the terminologies mean. For example, I got a test that was, the doctor said to me, "You have an expensive breast," and I didn't understand what that meant. But much later, he broke it down and said that that meant that I was going to spend so much money to get into treated because I was going to take Herceptin. And so some of these terminologies are not very clear to the patient. And then with anyone receiving a cancer diagnosis, the mind is already closed. The person thinks nothing but death. And so with a closed mind, understanding is very limited. So it's important that people are explained, things are explained to people carefully and clearly and in the very basic language they will understand. If one needs a radiotherapy, what does radiotherapy mean? How will it be done? If one needs a chemotherapy, what's the meaning of chemotherapy? What they know is drugs. They will be taking drugs. If the one needs sessions, sessions mean? To someone as lay in the village, a session might mean an educational session. So it doesn't come out very clear to them. And then to the caregiver as well, taking the person to the hospital, taking drugs in sessions, spending so much money, running some tests, need to do some platelet count and all of this. Most people don't understand what treatment of cancer is all about. And so sometimes it blocks them in getting a step further, in getting the very best of all they should get. My friends back here in Benue Breast Cancer were sharing with me their experiences. they have done surgery, some have done chemotherapy. The next phase is radiotherapy. But it doesn't not clearly understood to them when they should do it, or how soon they should do it, or when they must do it. And if at all they don't do it, what are the implications? What are the consequences? So for us, for a patient, the communication should be as basic as possible, because like I said, once you get that diagnosis, your mind is closed. All you think about next is death, or will I survive? And then you need someone who is going to sit with you and carefully explain the processes you're going to go through, the processes, your steps to take, and even places where you need to go to get all of this. It's not very certain to most people where they should go for radiotherapy. For example, most of the places that offer radiotherapy services are down in Nigeria. So are there alternatives? Are there private places they could go to? Or are there affordable places apart from the government-owned ones? Some of these guides will help people. Not everybody is poor and not everybody is rich. So for some who can afford alternatives to what government provides, it will help if there is a guide, if there's more information as to where they can go to, or if there's a link between a present caregiver and maybe another one in another town or in another location. Some of these networks are also important. I have been referring people a lot to places I feel I know that one or two things can be done better than what we have presently in my state. So it's important that communication, some of these other better service providers are also communicated to people. If there's a network that can help give the information so that people don't need to wait. Some people in our group have been waiting for the past 1 year or past 1 year plus, where they can go and access radiotherapy because government-owned facilities are not functional. Meanwhile, maybe there are private places that if they can afford, they might use. But then, of course, the private places oftentimes are very expensive. So communication, which has been what we've been talking about all day, can never be emphasized, overemphasized. You need to speak to people with love. You need to speak to people with empathy. You need to speak to people with clear words, not ambiguous. Like some people can come and ask you, will I die? Am I going to die? What answer should you give the person? Is an answer of assurance. If you say I don't know, it's not good enough, because that I don't know is very depressing. It's a very depressing answer. But if you give an answer like, oh, we'll try our best to give you the best care possible, we are hoping that it will turn out well. That is a better communication approach. That is a better language. That is a more reassuring, and that is a loving embrace from a caregiver to a patient. So I think the language, the tonation, the approach, the words that come out of our mouths, and even the written words are also important. If someone is to do certain tests, it's important to explain the processes to the person. You have to do a platelet count, you have to do this, you have to do that. They don't understand, they don't know. What is the implication of the platelet count if it is not done, or if it is done? What does it mean? Most people need to understand every step of this journey. It helps. It helps me because why? Because I'm a healthcare worker, and I could read. Each time I was given a paper to do a test, I would investigate further what that meant. But for someone who is lay, it will not come out so easy. So it's important that information on the various steps or the various procedures or the various treatment options available should be clearly explained to patients. They will accept care. We just had an awareness campaign celebrating World Breast Cancer Day in Benue here on Monday at the oncology unit in the government hospital. And for the patients that were there, the joy of seeing us survivors was the hallmark of their treatment. Some of them said they never believed people could survive, and that they never believed people could even live with so much strength like we do. So it's also important to reassure patients that it's not about death. You will see people who have lived, you will overcome. Because a woman there said she was almost giving up. She had told her children not to spend money on her again, but to keep the money they're using for her treatment. When she dies, they will use it to bury her. But upon our engagement with them on Monday, she said, wow, so it is possible I would live. So sometimes the facilities might need to bring people who are passed through the journey and are doing very well to reassure the patient. Through what the survivors say, patients can access care with more confidence, access healthcare with even more confidence, have more confidence in the caregivers, and have confidence in the healthcare systems of our country or wherever. So I think there is nothing better than communication. Communication in all sense will help the patient to access care better. And also the various steps of the journey. What does mastectomy mean? What does chemotherapy mean? What does radiotherapy mean? What does diet regulation? All of this. It's not everyone suffering this disease that is learned that will understand some of these terminologies. So it is good that the languages are broken. And then sometimes a patient is consulting a physician or a nurse or a pharmacist, and there's a language barrier. How do you explain? If I want to explain to you the use of medications and you're not learned in English and I'm not your local dialect person, how do I communicate to you? You might sometimes need the help of someone who can explain better so that the patient understands the use of the medications or the reasons for why certain services are going to be provided. So if things are not communicated well and clearly, we might miss a lot of patients and we might miss them surviving. For example, if you explain the stages of cancer to patients very well, it gives them hope. You have been diagnosed, but you are in stage 1. You have been diagnosed, but you are in stage 2. It helps the person understand the picture better, not just to say, yo, you have cancer. You have cancer. Cancer stage what? It will give a person a better control over accessing care and interest. Because some people feel that, once the diagnosis comes, this is death. So I think, and I'm confident with the engagement we had on Monday, I cannot but agree with the importance of communication in passing information across to patients, in that it will help boost them to survive. It will help give them confidence in the caregivers, the medical personnel on ground, and even in the family members of the support system that they need. It will also work well if we understand, or if everyone understands the steps of the journey. The cancer is a journey. It's a journey, and it passes from one stage to the other with its challenges and its issues. So if it's better explained, and of course the various types of cancers come with their various issues, problems. So patients need to understand better. I will appreciate if more of such engagements are even done in clinical settings. Maybe brief talks to patients before they start accessing physicians. It will help them. What we did was we talked to them before the medical personnel saw them, and we could see smiles on their faces. Survivors coming to talk to them, giving them hope, and adding up to what the medical system is also presenting to them as care. It will add up to their psychological state. They also need a lot of psychological support. It will
Yeah.
go a long way. It goes a long way. It goes a long way. Thank you very much. And I know that once there's a system that gives the psychological support, either from the healthcare setting or from the home, healing much more faster.
Yeah.
I feel that this outing by Pink Africa can even be done in a clinical setting, and the patient found full strength from it. Thank you very much.
Thank you so much, ma'am. Thank you for sharing your story. And you know, it is true, patient navigation is very important. You have been diagnosed with cancer. What next? Where do you go? What is radiation? What is brachytherapy? Many people in our, like in my country, they are not so learned. And we don't have, for example, we don't have a local term for brachytherapy. We don't have a local term for chemotherapy, for metastatics, and only a few people can actually pronounce these words. So how do you explain it to a lay person, a lay patient, to say therapy means ABCD in your local language? So patient navigation is also a very important thing. So you have been diagnosed with cancer and somebody comes to you and asks, will I die? What's the answer? What are you going to tell them? So you see, these are some of the things that we need to put in mind, and as patient advocates, as provide services, providers, we need to know some of these things, and even just caregivers. It is very important because our caregivers are our unsung heroes. So for me, I think I'd also advocate for caregivers to be trained on how to take care of the patients, and also the voice, the tone, tonations, body language, the gestures, it also matters. For example, I will tell you to say, may you please sit down? And I'll say, may you please sit down? So it's the exactly same words that I have used, but my body language, my tonation is so different, and so even the meaning actually changes. So let's also be mindful of the body language, body gestures, the tone of the voice as we communicate. So thank you very much, Madam Scholastica. We truly appreciate. Let's continue the conversation in the chat.